Well, good evening, everybody. Of course, I want to start by acknowledging that we meet on the traditional lands of the Ngunnawal and pay my respects to ancestors, to elders, past and present, and recognise all those with families and long connections to the lands we're on and the lands of the ACT and surrounding regions. I pay my respects to elders past and present. But I want to really focus on Auntie Violet. I've come to know Auntie Violet. I knew her a little bit before taking on this role, but I now know you very well. I think Richard's already described you as such a very special part of this community, and your welcomes are always, they move from the very personal to the very instructive as to what we all must do. And you share your own story and your family story, but also advocate for the rights of First Nations people and for respect and the role that non-Aboriginal people have in that role. And I just wanted to share with everybody the fact that the last time I saw Auntie Violet, we were both in the presence of the King and Queen. I was introducing Auntie Violet to their Majesties as they arrived to Parliament House a couple of weeks ago, and Auntie Violet was the last on the list, or the last of the group to be introduced, and it was a long conversation. It meant a lot to His Majesty. You spoke of providing boomerangs for his grandchildren and hoping that his grandchildren would come back with those boomerangs to see the work done over the years ahead that he was seeing firsthand. And I know there were many issues during the tour from those who probably didn't share that same opportunity for generosity with the King, but you did. And I then spent time with their Majesties after that event, and your kindness and your discussion about their grandchildren meant the world to them. So I do want to acknowledge everything that you've done, and in paying respect to you, I wanted to let everybody know about some changes that we've made at Admiralty House in Sydney, in Kirribilli, and will shortly make at Government House. In addition to having had smoking ceremonies before, Simeon, Lottie and I were spending our first nights in these houses and having those smoking ceremonies and blessings before we moved in as a mark of respect for the traditional owners. We've also looked at all of the art and artefacts in these houses that belong to all of you and wanted to ensure that the feeling of welcome for every Australian, but particularly First Nations Australians, was evident from the moment you walk in the front door. So in Admiralty House, when you arrive, I hope you come and visit in Sydney at some stage, Auntie Violet, together with your family. There is now an extraordinary painting from the National Gallery from Paddy Bedford. He's of course no longer alive, but he's an extraordinary Kimberley painter, and he painted a wonderful piece that we have on loan, which is a healing painting, a men's healing painting, and that is what welcomes people to Admiralty House. It's the first painting that those coming to our house there will see. And so as an offer of respect that everybody is welcome, but First Nations people are welcome in these grand homes, I want you to know that it's a focus for Simeon and me. And just as we change the art in Government House, I want to ensure that every person who comes to these houses can walk through the houses and find some part of your story, whether it's from 65,000 years of history, the British institutions and arrival of the kinds of roles that lead to my appointment, and then the extraordinary multicultural story that defines our future, that you'll all be able to find a story in a painting, in a photo, in an artist somewhere in the house. And so it's a mark of respect for you, Auntie Violet, that we've started that, and it has happened in Admiralty House. It will now happen at Government House, and I hope you come as a Ngunnawal elder to see that as we change the way in which the walls of these houses tell as much stories as the people who are in them. So you've inspired us to do better. So thank you. And I think a big round of applause again for Auntie Violet. So Professor Jenny May, AM, Professor Roger Strasser, AM, Dr. Lauren Cohn, Dr. Richard Colburn. And of course, to every one of you in the room, everyone in this room is a distinguished guest, but also the nominees and your supporters and the organisations who have partnered with Royal Doctors Network and Rural Health Pro to host this event. You are all the very, very special and exceptional guests. Now, one of the last times I was on this stage, I stood here before even knowing I would be taking this office. It was well before a conversation with the Prime Minister, but I stood on this stage and gave a speech on the value of the care economy and its primacy in our society. Now, things have changed a little bit since then, and I don't have politics or policy or money. I do have the power of advocacy, I do have the power of convening, and I have the power of amplifying messages and the power of the patronages and being able to spend time amplifying the messages wherever I find them. And so tonight, this is an absolute privilege, it's a great privilege to join a group of such dedicated and generous healthcare practitioners. You epitomise not just the care economy, but you epitomise care and compassion across the country. And this was evident. This event was one I was never going to miss. It was in the diary and nothing would move it. And as it turns out, on a night where there may be distractions in many parts of the world, causing us all sorts of challenge and interest, perhaps it's the best night of all to be celebrating the best of care here. It's a tonic and a balm for events that are occurring all over the world as we sit here in one of the safest, most prosperous, extraordinary economies and democracies. And how better, there could be no better way, I think, tonight than to be celebrating those of you that care and have come together to celebrate with each other and look to the future. So I'm so delighted that we're all here tonight in the spirit of celebration of absolutely the right thing for this country. So many of you have travelled long distances. We saw that in the hands that went up. And you all bring with you to Canberra the stories of the people and places to whom you devote your skills and expertise. You travel with the gratitude and recognition of the communities where you perform such vital work. And as you all know better than anybody, healthcare is so much more than just about treatment. It is education, it's prevention and management, it's project planning and execution, it's communication, collaboration and innovation and so much more. And as healthcare professionals, you achieve your goals in respectful partnership with patients, clients, families, and as we've already heard, communities. Yours are not just jobs, but vocations of care. Your work is essential to the wellbeing of all Australians and the prosperity and progress of our nation. Adding the multidisciplinary complexity to the challenge of delivering healthcare to the rural and remote regions of this vast continent does present you with really difficult and unique challenges though. Challenges that you all work to solve with a fierce determination. And I just love the fact that the good news stories that scroll across my feeds, and I hope most feeds across Australia, are generally about the things that are happening in rural and remote health. Life-saving care provided in an emergency, for example, always captures our imaginations and is rightly a cause for celebration wherever we are in the country, looking at where you are. But it really is the routine acts of care and compassion that sit at the heart of healthcare outside the major capital cities. From obstetrics in Cape York to community pharmacies in the Northern Territory, from optometry in Ivanhoe to speech pathology in Tasmania, from telephone support lines for individuals to digital training for practitioners, from striving to improve Aboriginal and Torres Strait Islander health outcomes to making sure that effective and culturally appropriate health messaging and care is received by all communities, even in the most remote communities. And the next generation of healthcare professionals will benefit so enormously from your collective insight and experience. The increasing numbers of placements and residencies that co-train students in communities will undoubtedly continue to contribute to ending the devastating disparities in Indigenous health and other health concerns. You are all a modern, innovative and connected workforce achieving extraordinary things. Rural and remote healthcare professionals, as you know, keep regional communities healthy, safe and strong. And regional Australia is such a vital and vibrant part of Australian life, where so much of the mighty story of our nation plays out in three parts, I tend to think, which tell the story of this country. As I've already indicated, our Indigenous foundations of 65,000 years, our strong democratic and civic institutions, and our remarkable multicultural present and future. And so much of that story is actually told in the history, diversity, culture and economy of regional Australia. In the energy of the people, often in the face of enormous challenge and change that's going on constantly. regional Australia makes a mighty contribution to the growth and progress of our nation and the communities that you serve. I think that the wellbeing of all Australians living in rural and remote areas is a national priority. And in the 4 months since my swearing in, I've been privileged to meet the impressive and inspiring Australians from many different backgrounds and walks of life, particularly across regional Australia. Sometimes it's been here in Canberra though, sometimes it's been in Sydney, and sometimes it's been in cities and towns, but I have visited every state and territory except West Australia, and I'll make a comment about that in a moment. But wherever I've gone, I've been given that unique and privileged gift. It's one of the greatest gifts of this office, and that is the panoramic view of our nation. Next week, I am travelling to Western Australia for the first time, so I'm glad you're here tonight. And I was only delayed because of a royal visit. So when the royal visit was announced, our plans to come to WA in my first 100 days had to be postponed slightly, but it wasn't through lack of interest. And I certainly visited your governor before I took office to learn about what he believed the responsibilities of an East Coast-based Governor-General would be for the great state of West Australia. So to all of you here, I'm thrilled, to the West Australians, I'm thrilled I'll be seeing you in West Australia in less than a fortnight, and I'm doing some really important things. Many of it is involving health and wellbeing. But throughout the travels I've had already, I've been seeing an Australia that's brimming with talent and energy, thoughtfulness and optimism, fierce determination, and a powerful sense of our combined optimistic future. But above all, I've seen that Australians are deeply connected to each other and absolutely strengthened by the bonds of the communities that they share. The acts of care, kindness, and respect have been just extraordinary. But they've also been in the context often of recovery. And many times I'm in communities, such as I was last week in Lismore and Ballina, in the northern rivers of New South Wales, so devastatingly affected by the floods of 2022, and then another flood shortly afterwards, that when I meet people in those communities and they talk about the strength of community, they do ask me that when I travel and amplify their story, that I hesitate before I use the word resilience. They ask me not to just assume that communities that get through these devastating moments are resilient and therefore ready for the next one. The communities of Lismore and Ballina and the surrounding regions would rather be described as in recovery and recovering well, but they say that at the centre of their recovery is their community and the way their community has handled the follow-on from the first wave of response that always comes, but it's their community strength that are getting them through. And I think, Richard, you said something vitally important in your opening remarks, which I've been hearing wherever I go. What we learn from those recovery moments is that communities know exactly what's right for them, and that policymakers and systems designers often forget at the peril of the community that what they're doing from places like Canberra or capital cities may work in theory, but without the evidence of what's happening locally and the strength of community knowing exactly what will work in place, then the solutions just don't work. And I'm hearing that wherever I go, that local-based, place-based solutions with the information from those communities, particularly those that are in recovery from devastating natural disasters, but not just those matters, that's the key to understanding what the solutions will be. And it was wonderful to hear you say that this evening, because that's what I'm seeing wherever I go, communities reaching out for that respect about local solutions. And I know that as practitioners in those communities, you know that too. And so interacting with the system, with the policymakers, dare I say it, the politicians, not that I can speak about politics at all, but they need to understand that these are the things that change a community and heal a community. And I will never talk about just pure resilience on the basis of what I'm hearing. So what I witness in all these interactions is a deep love for this country. And I don't mean that in a prosaic sense, I mean it in a fundamental sense, and for each other. And then during the visit of the King and Queen, it was an absolute privilege for Simeon and I to then experience uphand very closely with them their kindness and their generosity and their deep affection and admiration for Australia. And for all Australians, I'm hoping that it was an historic encounter, because King Charles is a modern king. And he actually epitomises what I've been asked to do, which is to amplify the best of modern, optimistic and diverse Australia. And that's what I saw in his interaction with you, Auntie Violet. He was actually wanting to understand more about your life and the place of First Nations in a modern, optimistic and diverse Australia. And that's what I see wherever I go, and is the deep and resonant place of care within the Australian identity that I don't think we speak about nearly enough. We're almost frightened to talk about care because it sounds soft or feminine or not real. It sounds like something we hope for, but that we don't actually invest in. And so I've committed since the 1st of July in my opening remarks to the Senate when I was sworn in that the entirety of my 5 years would be defined by care and kindness and respect. And when I say that, I mean care for each other, care for those who care, that's all of you, care for our extraordinary continent and its environmental assets and its beauty and its landscapes, care for civics and institutions, and care for the way we discuss the tough issues of our time, respectfully, without rancour, without hate, and without descending into violence, and finding pathways for discussions and debates where we can disagree well, because we're not really practicing that as often around the world as we need to, but in Australia we used to be able to do that very well. I thought it was a national character that you could have an angry, well, you could have a vociferous debate with your mates, but you could walk away friends and respect the other's opinion. And my view is that if we don't pay care to the various things I've said, plus the care in the way which we discuss the matters, particularly the things that you care about, looking for solutions, then that complacency can lead us to places and examples we're seeing around the world today where other states of being are taking hold and where care is being forgotten. So I am, as your Governor-General, I'm committed to elevating care, kindness and respect, and you'll see it in everything that I do and the office does. And to do that, I need to amplify the stories of people and communities who are working with purpose to embed those kind of values in the way they encounter each other and the world around them. So that brings me very, very briefly and to close with tonight. The winners and the nominees of tonight's awards are the best of us, together with those of you who nominated and supported, trained, mentored. But these winners and their nominees represent for me exactly the stories I will take to the rest of the country. You are working with us every day with integrity, compassion and a commitment to our country's future and the world's future. So I'm so privileged to hear those stories firsthand when I visit communities, but tonight the stories we will hear and we can share with one another in the celebration that follows, they're the stories that I'm going to carry with me to share with the rest of the country wherever I travel and celebrate throughout my term. So congratulations to everyone in the room, but a particular congratulations to all the nominees. It's hard to have winners on nights like tonight because I think everyone that's got to this point is extraordinary and should be celebrated. But on behalf of all Australians in this role, you are just magnificent. You epitomise care. That's where our future lies. And so I'm so delighted to be here with you tonight and celebrate well. Thank you.